So the purpose of this video is to go through some differentials of salivary gland swelling. Most of it is done extemporaneously, which means winging it, that's all that means. So I apologize if I am going to leave out any important information. Please let me know. So I think it's helpful to think about acute and chronic processes when we're talking about salivary gland swelling, as well as unilateral and bilateral. And we're going to go through each category and talk about some differentiating factors between them. We're talking about acute unilateral salivary gland swelling, two main processes that can make that happen. The first is an obstructive cause, the second is an inflammatory cause. Like the name implies, salilithiasis, salivary stone process. There's a stone in the duct, and when you salivate, either when you're eating or you're thinking about food, there's an obstruction causing a backup and a swelling of the gland and pain. So as a result, this is really intermittent, right, when you're only eating food. And that is differentiated with salinitis, which is an inflammation of the salivary gland. And first, let's break this down into infectious, and non-infectious. This is usually seen in a dehydrated patient. There's stasis of salivary flow and there's contamination of the duct, usually caused by Staph aureus. And it's not intermittent because it's infectious, it's progressive, and focally tender. And if it's an infectious cause, you could probably expect to see some fever, and because of Staph aureus, purulent discharge. As opposed to the stone, where it's not an infectious process, you're not going to have such systemic features. The fever and purulent discharge could also be used to differentiate between non-infectious causes, and the main differential here is external beam radiation. Usually the question stem a person with a history of head and neck radiation, so you're not going to have the high fever and purulent discharge that you might see in the infectious cause. And perhaps you'll also see some loss of taste. So where do these occur in the stone formation? They typically occur in the submandibular because of the submandibular gland's ascending course. It's anti-gravity and lends itself to stone formation. Also, the submandibular gland, unlike the parotid, has a more mucinous secretion and has a higher calcium concentration, again also increasing likelihood of stone formation. So we'll go to acute bilateral causes. The main things to think about is a viral cause, usually mumps, unvaccinated child. It begins unilaterally, so read the entire question, and then progresses to bilateral typically, and it is painful. The reason why that's important to mention is that HIV is also viral, but usually painless and also cystic. The next differential is radioactive iodine, and you could think about it as a systemic radiation that you're getting through your body, so it makes sense that both glands will be affected bilateral, and we'll see that somebody's being treated maybe for their hyperthyroidism or their thyroid cancer. And importantly, this is painful. In contrast to IV contrast reaction, pun most certainly intended, somebody reacts to the iodine and it is painless. Perhaps because it's not radioactive. So moving on to chronic salivary gland swelling and unilateral causes, the main differential is a tumor, and chronic bacterial infection could cause a unilateral chronic swelling. And typically when there's a chronic process, there's degeneration of the glands. You'll have decreased salivary flow and dry mouth perhaps. And speaking of dry mouth and bilateral causes, we have an autoimmune cause, Sjogren, classically. Perhaps there'll be an associated dry eyes, and maybe in the question stem they'll give you someone with rheumatoid features, if they're nice. The second on the list is sarcoid. This is an infiltrative, and perhaps the question stem will tell you that the patient got an x-ray and saw classically the bilateral hyaluroadenopathy. And lastly, malnutrition of sialadenosis. And osis means formation of, typically of the parenchyma. So it is thought that there is a neuropathy of the parasympathetic nerves that supply the glands, causing increase of parenchyma, subsequent fatty infiltration in the salivary gland. You could also think about it in alcoholics. A lot of times have fatty infiltration in the liver. So this is the overview of salivary gland swelling differentials. We'll go over them again quickly one more time. In acute unilateral salivary gland swelling, there's obstructive causes, inflammatory causes, stone, submandibular, parotid, infectious, progressively painful, purulent, fever for infectious, radiation, history of radiation, maybe loss of taste, non-infectious, is viral, painful unless it's HIV, cystic, painless, Radioactive iodine is another cause. It's like systemic radiation. IV contrast reaction, non-radioactive, painless. Chronic, there's tumors. Chronic bacterial infection. Talking about bilateral, think about systemic causes. Sjogren, autoimmune, maybe associated dry eyes. Sarcoid, infiltrative, and malnutrition. Cellulosis, alcoholics, diabetics, eating disorders. Think about as a neuropathy of the parasympathetic nerves that supply the gland. Thank you for watching. I hope to do many more of these.